Hi, I'm your nurse today, and I'm going to ask you an extensive health history.
Okay.
You're okay with that?
Yes.
Okay, because it's going to be a little bit, and you're going to get a lot of questions. Okay. What is your complaint today? What's bothering you today?
Back pain.
Back pain. When did this back pain start?
About 2 weeks ago.
2 weeks ago. Do you know what happened?
No, I'm not sure.
You're not sure. Okay. Do you know what makes it better or worse?
Motrin makes it better.
Motrin. Okay. Does it interfere with any of your activities, work, or anything like that?
Not really.
No. Okay. And did you have any other treatment for this back pain?
No.
No treatment. Okay. All right. I'm going to ask you some other questions about childhood illnesses. Do you know of if you've had any measles or mumps, chicken pox, rubella, anything like that as a kid? Scarlet fever?
Chicken pox.
You did have chicken pox? Okay. All right, now I'm going to ask you about some adult illnesses. Have you had any, do you know if you have TB, anything like that, or hypertension, hepatitis, ulcers, cystitis?
No.
No? Now, do you have any depression? Were you diagnosed with bipolar, anxiety, things like that? No? Okay. All right. Now, have you got all your shots, like your tetanus shot, your pertussis, polio?
Yes.
All your childhood shots?
Yep.
You're up to date, and you know when the dates are for those?
I do.
You do? Okay.
Yeah.
Now, I'm going to ask you about your medical history. Do you have any past illnesses that you were diagnosed with?
Serious illness?
Serious illness, yes.
No.
Or non-serious?
No.
No? Okay. Do you have a surgical history? Have you had
Yeah.
surgeries?
I have.
And what surgeries are those?
Gallbladder removal.
Gallbladder? And when was that?
It was last July.
Last July? And is that your only surgery?
Yes.
Okay. All right. And were you hospitalized during that surgery?
Just overnight.
Overnight?
Observation.
Oh, for observation. Okay. So just one day then?
Yeah.
Okay. Any other times that you were hospitalized overnight?
No.
No? Okay. Now I'm going to ask you about how you feel about your overall health. Do you feel like you're a healthy person?
Yes.
Yes, you do. Okay. Now, are you a happy person? You said you can have anxiety, anything like that.
No.
So, overall, do you feel okay?
Yes.
Yes. Okay. Now I'm going to ask you about your family history. This could be your any family members, like your grandparents, your parents, your sibling, your spouse, your children. Now, do you know of any chronic illness, physical or emotional, in your family?
Prostate cancer. My
Prostate.
grandfather.
Okay. Anything like diabetes, cancer, hypertension?
Diabetes. Mother.
Mother has diabetes. And when was she diagnosed?
About 10 years ago.
10 years ago. Is she insulin dependent, or does she take pills?
She did take oral medication. Now she takes insulin.
Insulin, okay. Is there any depression, anxiety, heart disease, kidney disease in your family?
No.
Cancer?
Besides my grandfather, no.
Okay. Any migraine headaches, glaucoma, obesity, or alcoholism?
My father, migraines.
Migraines, okay. And is he getting treated for those?
Yes.
Okay. Any anemia, bleeding disorders, stroke, epilepsy in your family?
No.
Okay. Your spouse or children, either any of this, correct?
Right.
Okay, all right. Have you had any injuries or accidents, that you broke a bone?
Just broken fingers as a child.
And were those, did you have any treatment for those?
Just splints.
Just splints, okay, and they healed okay?
Yes.
Okay. Now, do you take any medications for anything?
No.
Nothing? No multivitamin or anything like that?
Multivitamin.
Multivitamin, okay. Do you have any allergies to medications or foods, dust, animals, pollens, anything like that?
Nope.
No? Okay. Now, I'm going to ask you, this might be a little different of a question. Now, when you were a child, were you normally on a smaller growth chart, or were you above compared to like your brothers?
That's above average.
Above average, okay. Now, do you feel like when you were with your friends playing and stuff that you were on the same level, communicating with them, or nothing was ever out of the ordinary for you with your friends and siblings or anything like that?
Nope.
No? Okay. Now, do you have living grandparents?
Yes.
Yes. Okay. At both sets or
Just on my father's side.
father's side? Okay. And are your mother and father still living?
Yes.
Yes. Okay. All right. And now I want to ask you about a few of the things with your body. Now, do you have any skin problems that you know of? Any dry skin? Any open areas, bumps or lumps, things like that might be bothering you?
Nope.
No? Okay. Now, your hair or your nails. I see that you don't have hair. Do you just shave that? Or
I do.
Okay. Do you have any problems with your nails or anything like that?
No.
No? Okay. Now, is the hair on the rest of your body okay? You're not having any hair loss there or anything like that?
No.
Okay. Now, eyes. Do you wear glasses?
I don't.
You don't wear glasses? Okay. Do you feel like you have any eye problems or anything like that?
Nope.
No? Okay. Do you have any trouble hearing? Do you have hearing aids? No. No? Okay. Do you have problems with your sinuses?
No.
No. Okay. And like with your mouth, do you have any sores in there? Any like gingivitis that might be bothering you? Things like that?
No.
No? Okay. Now with your neck, do you feel any lumps or bumps ever, or do you have neck pain?
No.
No? Okay. Now respiratory problems, do you have any difficulty breathing? Any problems like that, asthma or anything like that?
Nope.
No? Now I'm going to ask you about your cardiac, which is your heart. Do you know of any heart problems or concerns that you might have? Any pain, any like racing of the heart, palpitations, things like that?
Nope.
No? Okay. And now, like, do you have any diarrhea, nausea, irritable bowel syndrome that you know of? Any
No.
problems in your stomach area or your abdomen?
No.
No? Okay. Now, with your bones, you any pain or arthritis that you know of in your bones?
No.
No? Okay. Now, do you have epilepsy, any time that you passed out, any strokes, brain diseases?
No.
No? Okay. Now, you said your mother had diabetes. You have never been diagnosed with that, or
No.
you don't feel that you have any trouble in that area?
No.
Addison's disease, adrenal disorders, anything with your hormones?
No.
No? Okay. Any blood disorders, anemia, bleeding a lot, just like if you got a cut or sore or something like that and it's hard to stop the bleeding? No? Okay. Kidney disease, diagnosed with UTIs, bladder pain, cystitis? No? Nothing with kidneys? Now, do you drink?
Occasionally.
Occasionally. Now, how much do you typically drink in a weekly span?
One or two beers a couple times a week.
A couple times a week? Okay. Do you smoke?
No.
Any recreational drugs?
No.
No? Okay. Do you have any stress anything that's bothering you? That you feel stressful any day?
No.
No? Okay. Do you exercise?
Not as much as I should.
Okay. Just like everyone. Now, your nutrition, how do you feel that you eat? Do you have 3 meals a day at least?
Yes.
Yes. Okay. Do you think they're well balanced
It's a balance.
meals?
Yeah, balanced diet.
Okay. I think that's it for our history, and we will go on to the physical assessment.
Okay.
Thank you.